Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Guillermo Ruiz.
Hello everyone. Today's guest in the show is David Winston. David Winston is an herbalist and ethnobotanist with over 40 years in training in Cherokee, Chinese, and Western herbal traditions. He has been in clinical practice for over 35 years and is an herbal consultant to physicians, herbalists, and researchers throughout the USA and Canada. In 2013, David was presented with the Natural Products Association Clinicians Award. David is the founder and director of the Herbal Therapeutics Research Library and the dean of the David Winston Center for Herbal Studies, a 2-year training program in clinical herbal medicine. He is an internationally known lecturer and frequently teaches at medical schools, symposia, and herb conferences. If you want more information on botanical medicine, check out my website, 3030strong.com. And don't forget to share this interview with your friends and family. I hope you enjoy the show. Hello everyone, I'm here at the Southwest Botanical Medicine Conference in Tempe, Arizona. And I have the pleasure to have an interview with David Winston. So for our paleo community that might not be in touch with this botanical movement, can you give us like your hero story?
I guess we can say that at a very, very young age, I became fascinated with plants. I grew up, this would be in the late 1960s. I always say that all my friends were interested in one plant and I was interested in all the other ones. And I just became fascinated with this idea, having read this book by a man named Yule Gibbons, Stalking the Wild Asparagus, that you could go out into the woods and the fields and find edible and medicinal plants. To me, it was incredible. And I fell in love with plants. I absolutely fell in love with plants. And I taught myself field botany, although I made quite a few mistakes. I would buy every herb book that I could find and read them all. And I had this philosophy that I still actually have to this day, is that I don't give my patients things that I haven't tried myself. And so I would go out, learn to identify plants, bring them back, dry them, make them into teas or tinctures or whatever, and experiment on myself and see what happened. And I have lots of funny stories about being rather ignorant and taking too much of something or not enough and having all sorts of interesting experiences. And so over the years, luckily, I had an uncle and an aunt, who's actually not more distant than an aunt, who were Cherokee from North Carolina. And I got to spend summers down there and learned about that tradition. Later, I lived in New York and apprenticed with a Chinese HIT doctor, acupuncturist, and doing martial arts medicine for several years. Then I went to college and took classes in anatomy and physiology and pathology and pathophysiology and cellular biology and all that sort of thing. And started practicing as an herbalist back in the middle 1970s. Actually, one other person I should mention was one of my other early teachers was a brilliant American herbalist named William Lesaussier, who I had studied with. And so I started practicing as an herbalist, and at this point, now in 2017, I've been studying herbal medicine for 48 years, and I've been in clinical practice for 41. And I feel so blessed. I've spent my entire life basically doing what I love to do, and that is learning about the plants and helping people to understand them. I teach all over the US, Canada, Europe, Costa Rica, teaching people how to utilize herbal medicine, because when I first started doing this, it was really hard to learn about herbs. Luckily, I had some family connections, as I mentioned, but it was hard because we were coming out of what I call the herbal dark ages. This was a time where herbal medicine ceased to exist within mainstream America. Yes, it still existed in some ethnic and rural communities, but for the most part, herbal medicine was gone. When people would say to me, "What do you do?" I'd say, "I'm an herbalist." They'd look at me like I was insane. They go, "You mean like spices?" And I go, "No." And if they were really smart, they might say, "You mean like potpourri?" And I go, "No, medicinal plants." And they would just shake their head thinking, thinking, poor misguided youth, why would you waste your time doing something that, went out of fashion 100 years ago? People would say, that's stuff witches used to do. And I was stubborn and fascinated, and so I just kept doing it. And luckily for me, here I am. I've been trained in multiple systems of herbal medicine, and somehow, as I said, lucky for me, the world kind of caught up, and all of a sudden, people are interested in herbs again. And this really kind of bloomed in the 80s and especially the 90s. And so I find myself in the envious position of, having been trained in multiple traditions of herbal medicine. I have sort of a cross-cultural approach to herbs. I'm trained in Chinese herbal medicine and Native American herbal medicine and Western eclectic herbal medicine. And I've created this synthesis of these traditions because they have many things in common, some things different as well. And love to teach people how to use them, and I still have a clinical practice, and I write books and articles and have a 2-year herb studies program. I have a school. So I do all sorts of different things, and it's all revolves around herbal medicine.
And the reason I wanted, I was counting down the days to the conference was to ask you about adaptogen herbs, because that's a big topic within the paleo community, within the ancestral community. But just a couple of seconds ago, we had a conversation on how we are misusing botanical medicine, because botanical medicine shouldn't be used as an allopathic method.
Right.
Could you elaborate on that?
Certainly. So basically, when we look at the world's great herbal traditions, whether we're talking about traditional Chinese medicine, TCM, Ayurveda from India, Tibetan medicine, Kampo from Japan, Jamu from Indonesia, Tibetan medicine, Unani Tib, Greco-Arabic medicine, what we see is that people use complex formulas because they're dealing with complex people with complex problems. So the idea of using simples, a single herb at a time for a single problem, is almost unknown within traditional herbal medicine. It's some folk traditions, but not in the great traditions of herbal medicine. In addition to that, Hippocrates said more than 2,000 years ago, it's more important to know the person that has the disease than the disease the person has, and he was right. If you use herbs allopathically, so everybody knows, St. John's wort is the depression herb, and saw palmetto is the prostate herb, and black cohosh is the menopause herb. Well, let's go back and talk about that for a minute. St. John's wort is not the depression herb, and in fact, of the more than 14 types of depression, St. John's wort is only of really benefit for 3. And we talk about black cohosh for menopause. Actually, black cohosh is not that effective for menopausal symptomology. So what happens is a woman hears it's good for menopause. She helps her hot flashes. She takes it. It doesn't do that much. And so what is her response? Oh, I tried herbs. They don't work. No, you tried the wrong herb or the wrong dose, and you didn't use a formula. Or saw palmetto for prostate. Saw palmetto is, it helps a little bit, but there are much better things. And so when we use these little sound bites of information about herbal medicine, we're doing a disservice to the plant, but we're also doing a disservice to the consumer, to the person using the plant, because they think they know it, when in reality they don't. Each plant has a complex personality. And so the more you understand that plant in the fullness of how it's used, with what other herbs it's used with, in all these traditional medical systems, there's this idea of synergy. Synergy is the skillful combining of herbs. 1 + 1 usually equals 2. But with synergy, 1 + 1 equals 3, or 4, or 5. And by the way, there's anti-synergy or antagonism where 1 + 1 equals 1. It's not just about throwing a bunch of herbs together. It's about putting herbs together that make sense for the person that's taking it, or if you're doing it as more generic, even for the condition that's being used for, that have to work well together. And not all herbs do that. And so it is vital that people understand, number one, you want to focus in on treating the person. And the foundational things come first. What are the foundational things? Diet, exercise, sleep, healthy lifestyle choices. And herbs are not foundational. Diet is. And so first we have to deal with those things. So if you have a person who has serious health issues and they're not getting enough sleep, you can take herbs all day, and it's probably not going to make that much of a difference. Or if you have somebody who is, just eating a terrible fast food diet, or a diet full of simple carbohydrates, and you're giving them herbs to lower blood sugar. Well, first you deal with the diet. Now, herbs are incredibly useful. And herbs, my aunt used to say that herbs fall into 3 categories as how they affect people. There are foods, medicines, and poisons. The food herbs are gentle, and they're not all things we think of as food. So yes, ginger and garlic are food herbs. Cinnamon is a food herb. But it also is things like lemon balm and hawthorn and peppermint. These are herbs that are generally non-toxic. You can take them in considerable amounts. But when I say considerable, you wouldn't sit down and eat an entire bowl of garlic at one time. So let's use a little common sense here. But you can use them in reasonable amounts and over considerable periods of time, and it's unlikely you can have any adverse effects. On the other hand, medicines, we already talked about things like black cohosh or a herb like golden seal. These are medicines. These should be used for shorter periods of time for a specific reason, and then you stop doing it when you don't need it anymore.
And always in synergy with other herbs.
And you're always using herbs in synergy. I mean, I can count the number of times I give somebody a single herb on one, and I've treated thousands of patients on one hand. I mean, it's rare, usually it's because we're somewhere out in the middle of nowhere and somebody says, oh, I'm nauseous. And I say, oh, well, here, just try some ginger, and that's fine if you're nauseous today, but if you come back tomorrow and you're nauseous, and the day after that, and the day after that, then something more significant is going on, and just ginger isn't going to do it.
Remove obstacles to health.
Exactly. So ultimately, we want to educate people as to the benefits of herbs, and they are great. But that last category, the poisons, those are plants that people who are not highly trained in the plant and toxicology shouldn't even mess with at all. Those should be left alone. So we want to educate people in herbs. The vast majority of herbs are very safe, much lower level of adverse effects than pharmaceutical medications. But just because an herb's natural does not mean it is always safe. There are toxic herbs out there. And a lot of Americans have this funny idea, if a little bit is good, more must be better. No. You don't want to exceed the recommended dosage. We want people to understand the benefits of herbs, how to use herbs safely and effectively. And if we get that information across, then what people will find out is herbs can offer them incredible benefits, not only for prevention of disease, but treatment of disease as well. They're not always a replacement for orthodox medicine, and it's not about orthodox medicine is bad and herbs are good or vice versa. It's about what's more appropriate for the specific person, what will help them, what works for them most effectively. So you have somebody with a lot of chronic degenerative diseases, which is what most people are dealing with today. Herbs shine in that area. On the other hand, if you have somebody with bacterial meningitis, you want them in the hospital with an IV antibiotic because that's what will work. And so it's knowing what's appropriate for a given situation, a given condition, and how to apply it appropriately.
And that's where we get in trouble within the complementary medicine, where you hear all these hit pieces on, oh, this person was trying to treat bacterial meningitis with echinacea, and
wouldn't recommend it.
And it's usually parents. It's almost never a practitioner, although there are some bad eggs out there. And so now the whole traditional medicine history takes a hit because one person made the wrong recommendation or recommended themselves the wrong herb. But let's talk a little bit about adaptogens, because you wrote the book on adaptogens.
Right.
So what better person to ask about adaptogens? So for the people out there who don't know what an adaptogen is, what's an adaptogen?
Well, first of all, just so you know, the name of the book is Adaptogens, Herbs for Strength, Stamina, and Stress Relief. And I wrote the book in 2007, and I'm talking to the publishers now about doing a second edition and update, because there's been a tremendous amount of new information about adaptogens in the last 5 years that's not obviously in that book, because it was published in 2007. There's another book on adaptogens out there that was published more recently, very good book. Unfortunately, it doesn't have the updated information either. And so what is an adaptogen? All right, so the original concept of all native traditional medicine systems have this idea of tonic herbs for the most part. So in Chinese medicine, they are called superior or kingly remedies. In India, they are known as rasayanas, the rejuvenative remedies. But these are not necessarily adaptogens, but these were herbs that people noticed helped to enhance overall health. Now, In 1947, in the old Soviet Union, a researcher named Lazarev, sponsored by the military, started doing research on substances. Originally, these were not herbs. These were chemicals that would enhance a non-specific state of resistance. So it would help make you more resistant to a wide variety of stressors. And the idea was to make better soldiers, better cosmonauts, better workers, etc., so that they could do what Khrushchev said, and that was bury the West. So it wasn't even a benign reason for doing it. Eventually, another gentleman takes over the research. His name is Israel Breckman, and he's considered the father of adaptogens. And initially, the research is on a Chinese herb, Asian ginseng. The problem with Asian ginseng is it doesn't grow in the old Soviet Union, and even though both China and Russia, Soviet Union were socialist republics, they hated each other, and they had the two largest standing armies in the world on each other's borders. And the last thing that the Russians wanted to do is pay their very hard, difficult to get, hard-earned Western currency to the Chinese for the ginseng, because they wouldn't take rubles. So they looked around to find an indigenous plant that would work, and they found a related plant, which was Eleutherococcus senticosus. The Chinese name is siwuja, and in America it was sold as Siberian ginseng, which was a misnomer because it's not a panax, so it's not really a ginseng, even though it is, as I said, related. It's in the Araliaceae family. And the original research was all on that plant, and it has gone on from there. Now, the definition of an adaptogen, the initial definition was it created a nonspecific state of resistance. That means it helps make you more resistant to psychological stress, physiological stress, temperature stress, noise stress, any type of stressor. Number two, in a normal dose, it's non-toxic. And number three, it has what would be called a systemic amphoteric effect, meaning it helps to re-regulate the body, the organism. So that was the initial definition. Later on, Dr. Dardimov and Panosian added to that, and they determined that adaptogens primarily worked through two master control systems in the body. The first is called the HPA axis, the hypothalamic pituitary adrenal axis, and what's called the SAS, the sympathoadrenal system. So the HPA axis controls almost all endocrine function, significant amount of nervous system function and immune function, and deals with chronic stress. Whereas the SAS, the sympathoadrenal system, is your fight or flight mechanism dealing with, acute stress. And so, number one, any herb that does not work through these systems cannot be an adaptogen by the very definition. Later, Dr. Panosian and Dr. Wagner, who are the world's greatest researchers on adaptogens today, further found, and this is some of the newer research, that adaptogens not only work through the HPA axis and the SAS, they work on a cellular level. And on a cellular level, what they are doing is they are upregulating some heat shock proteins, a fork-head protein known as FOXO, and what's called neuropeptide Y. Now, the interesting thing about these chemicals is that these are all upregulated when you're stressed out. So you're saying, wait a minute, adaptogens upregulate stress chemicals. Well, what they are doing is it's a little bit like getting a vaccination, except you're not getting an injection, you're taking it. And it says to the body, there is stress coming, get ready. So that the body is more able to respond to stress in an appropriate manner as opposed to inappropriate manner. And two other things are happening with these adaptogens. They are decreasing stress-induced cortisol levels, and elevated cortisol levels from chronic stress interferes with sleep, interferes with digestion, interferes with immune response, interferes with circulation, increases tissue growth. I mean, there's a whole bunch of belly fat. There's a whole bunch of things that happen from chronically elevated cortisol that are not positive. So it inhibits elevated cortisol levels, and chronically elevated cortisol levels causes basically mitochondrial shutdown in the cells. Well, it also prevents stress-induced mitochondrial dysfunction. So adaptogens are doing all these things, but in order to be an adaptogen, it has to do all these things. So there's lots of herbs out there that people claim are adaptogens, and even in my book in 2007, there were herbs I listed well-researched adaptogens and what I call possible adaptogens. Now I have categories that I use of well-researched adaptogens, probable adaptogens, possible adaptogens, and then there's all the herbs that people call adaptogens that aren't. So herbs like maca, all the evidence suggests it is not an adaptogen. Goji berry, astragalus, processed romania, they're not adaptogens. I would put them in a category I call nutritive tonics. They're great herbs, they're very useful, but they're not adaptogens because they don't fit the definition. And because the definition of adaptogen comes from the science community, it's not something herbalists made up. We just can't change the definition. There's a real definition for what an adaptogen is. So some of the most well-known adaptogens are the ginseng. So you have Asian ginseng, the red and the white, same plant, just different processing. You have American ginseng. There is also, by the way, a Vietnamese ginseng. There's a ginseng from China called Tianchi ginseng, although it's more used to stop bleeding, but it is an adaptogen. You have herbs like cordyceps. You have with the caterpillar fungus cordyceps. You have the Ayurvedic herb ashwagandha. In addition, you have holy basil, which is a very mild adaptogen. You have eleuthero, which is the formerly Siberian ginseng, which is also a fairly mild adaptogen. You have things like schizandra, uezi, a 5-flavor fruit, which is a Chinese herb. So we have a significant number of adaptogens, but of plants that are well-researched adaptogens, I would say there's probably no more than 10. Then I would say that there are probably another 10 or 12 herbs that I would call probable adaptogens, including things like shatavari and Codenopsis, the Chinese Dongshan. Then there's probably another 12 or 14 plants that are possibly adaptogen, but the evidence is much, much skimpier. And then, as I said, there's lots of herbs that people have called adaptogens that there's absolutely no evidence that they're adaptogens at all.
They might be modulating some sort of process, but it's not covering the whole gamut.
Right. Well, the whole thing is just because something relieves stress doesn't make it an adaptogen. And so, nervines are great. There's certain herbs I call companion herbs that I use with adaptogens. So nervines are basically help restore the emotional foundation. Or nootropics, which enhance cerebral circulation and are neuroprotective. Or the nutritive tonics. These are great herbs to use with adaptogens because you wouldn't just necessarily, I never just use adaptogens. So having a formula that's nothing but adaptogens doesn't really make much sense. And I would also point out to the listeners that adaptogens are not a one-size-fits-all phenomenon. And so what do I mean by that? Well, some adaptogens are stimulating, some of them are calming, some of them are heating, some of them are cooling, some of them are drying, some of them are moistening. So you have to determine which adaptogen is appropriate for this person. You have somebody who's easily overstimulated, the last thing you want to do is give them red ginseng or rhodiola, both of which are stimulating adaptogens and can exacerbate insomnia and irritability and blood pressure. On the other hand, you have an adaptogen like ashwagandha, and ashwagandha, one of the things it does, in addition to being an adaptogen, it stimulates thyroid function. So ashwagandha is very appropriate for somebody who has something like Hashimoto's thyroiditis, which is an autoimmune disease, and hypothyroid, but you wouldn't give it to somebody with Graves' disease, which is an autoimmune disease that causes hyperthyroidism. It would be contraindicated there. So it comes down to knowing, as I said before, that personality. Each plant has a personality, and the more you understand that, the more you can sit there and say, does this herb make sense for this person? Rather than, oh, you need an adaptogen. Well, maybe I'd say the majority of people adaptogen wouldn't be a bad idea, but which one?
Is there a way that, or do you ever prescribe adaptogens throughout the day and switch the formulations throughout the day? Like in the morning, something more that's going to spike your cortisol a little bit more, and then towards the end, maybe ashwagandha to even you out?
Actually, I'd say for the most part, I don't do that very much. What I generally do is I create formulas that are specific to that person. And so most people, what you're really looking at is their overall pattern rather than trying to switch it out throughout the day, which makes it much more complex. Now, I can't say that I never, for instance, I might have somebody with insomnia where I have them taking certain things throughout the day and then have a sleep formula for night. I might not necessarily put an adaptogen, though, in that sleep formula. I may just focus in on nervines and possibly some sedative herbs or something like that. So generally speaking, when I use adaptogens, I kind of try to figure out which one is appropriate for that person, and then they'll usually stay on that formula for about 4 to 6 months, and then you reevaluate and see whether it's still appropriate. Now, obviously, if they have a problem, you would look at it sooner, but most often that works. And the beauty of adaptogens is that they, for the most part, it's not like taking a stimulant where you take most adaptogens, you take it and it's not like, oh my God, I have all the energy in the world. The effect tends to be gradual. And so you want to give it that time to see that it's going to be effective and work for that person.
What are some of the short-term effects of an adaptogen, or how would you know if you have the right adaptogen formula for you?
Well, I think it's easier to know sometimes if you have the wrong adaptogen formula. So for instance, like, as I said, rhodiola is not only very stimulating, it's also very drying. So if you have yin deficiency, dryness, dry eyes, dry mouth, dry skin, for a woman, vaginal dryness, things like that, rhodiola can exacerbate that dramatically. So then the question is taking the adaptogen causing any problems, all right? If you find over a period of weeks that you're feeling more energetic, but at the same time, we say energetic, appropriate energy, not inappropriate energy.
Not fidgeting, not insomnia.
Well, yeah, exactly. So you feel more energetic, you feel more rested when you wake up in the morning. Maybe you are, you're not waking up in the middle of the night, feeling anxious. Perhaps your blood pressure has gone down a little bit. If you have stress-induced headaches, they're diminishing. So anything that stress can do, and obviously we know stress can cause palpitations, stress can cause hypertension, stress can cause increased IBS type symptoms. Whatever type of stress patterns you have, you're seeing a reduction of those things. You're feeling better. And a lot of it's going to be rather nonspecific because, you don't take an adaptogen for hypertension per se, although certain adaptogens may be very useful for a person who is hypertensive. I would add in other herbs that are specifically, bring down blood pressure at the same time. But what you are looking for, as we said before, adaptogens help re-regulate the HPA axis, the SAS. So we're looking for improved endocrinological function, improved immune function, improved nervous system function, all of the above. And then when we look at the HPA axis, we are talking about not just the pituitary and the adrenal, but we're also talking about sexual reproductive functioning, all of which is part of the HPA axis.
And okay, so for my listeners out there there's so much buzz about this adaptogen and they want to get into an adaptogen. What are some recommendations for them to find a practitioner or to maybe do some research to find their own adaptogen?
Okay. Well, I'm not a keen self-promoter, but I will say that one of the reasons I wrote my book was to help people understand what an adaptogen is, what it isn't, and to explain the difference between different adaptogens. So that is a good source. Practitioners, hopefully, if you know good clinical herbalists, members of the American Herbalist Guild, or naturopathic physicians, hopefully they are familiar with this, although I can't say that all are. There's still much confusion within both of those communities as to what is and isn't an adaptogen. I would be very cautious about what you read on the internet and in popular articles because I see them all the time and I see misinformation more often than I see good information. So honestly, it's not the easiest thing because adaptogens, they're miracle drugs. Anytime somebody tells you something's good for anybody and everything, run in the opposite direction because it isn't. If it sounds too good to be true, it is too good to be true. And so, when people say to you, oh yeah, Shilajit, which is a herbo-mineral concretion, oh, it's good for everything. Well, no, it's not. Does it have benefits? Yes. Does cordyceps have benefits? Yes. Does rhodiola, ginseng, schizandra, ashwagandha have benefits? Yes. But are they correct for you? And that gets down to knowing the plant. Not knowing it's an adaptogen, knowing the plant. Knowing, again, is it heating? If you already have heat signs, fever, sharp pain, reckless blood where it doesn't belong, inflammation, then you don't want heating herbs. Is it cooling? If you have signs of stagnation, cold hands and cold feet, hypoactivity of organ systems, dull throbbing pain, all signs of cold, you're chilled, then you don't want cooling herbs. Again, if it's stimulating and you're already overstimulated, not a good combination. If you are already depressed and lethargic, then you certainly don't want a calming adaptogen. You'd want something that's more stimulating or maybe neutral. If something is drying and you have deficient yin, dryness, obviously inappropriate. So you want to start looking at it from an energetic perspective. And that's one of the things that all traditional systems of medicine have, is this idea of energetics. And energetics is, I always say to people, and in my class today, I asked the question, I said, how many of you want to be good herbalists? Everybody raised their hand. And my response to that was, wrong answer. If you're going to be an herbalist, be a great herbalist. Don't bother with good, be great. But if you're going to be great, if you're going to learn about herbs, then you really have to educate yourself. And again, be aware, when you look at commercial products and you look at the websites and you read what they say, how is it that every product claims to be the best? Well, that's patently impossible. Everything can't be the best. So if it is commercial literature, take it with a large grain of salt. Who is the person writing this? What is their level of expertise? How long have they been a clinical herbalist? Because if they're just a writer writing about herbs, I don't trust it. And if there's somebody who just got interested in herbal medicine and has read all this other stuff on the internet and now is an expert, I wouldn't trust that either. How many decades have they been doing this? Where did they get their training? If they're a professional member of the American Herbalist Guild, it means they had to go through a very extensive peer review process to be accepted. If they're a doctor of naturopathic medicine, then they had to, earn that degree. If they're a medical doctor, they had to earn that degree. So you're looking for a certain level of competence. When they're telling you how to use herbs, are they differentiating? Or are they just saying, anyone's good? Anybody says that, they don't know what they're talking about. Somebody says, you just mix a bunch of adaptogens together, just throw it together. No, they probably don't know what they're talking about either.
Or they might have those combinations and they might be anti-synergistic.
Well, that's true, but most people wouldn't know how to determine that. But like, for instance, rhodiola, which is really drying, has a lot of tannins. And if you put rhodiola in with herbs that are really moistening, things that have a lot of like mucopolysaccharides, it will basically condense those mucopolysaccharides, making them insoluble.
And they go out of solution.
And they go out of solution, and you've just ruined if you're talking about a tincture, you've just ruined it. So again, but where does that come from? Experience and knowledge.
So how did all this traditional groups, from the Ayurvedic, traditional Chinese medicine, where did they get their microscopes?
Well, they didn't have microscopes, and so they basically learned by multiple ways. What you commonly read is it was all trial and error. Now, trial and error certainly took part of it, but native people learned from dreams, they learned from visions. There's a whole new field of study called ethnozoopharmacology, looking at animals. We've determined that animals use herbs. Bears are considered to be the herbalists of the animal kingdom, using 30 or 40 different plants for different things. Elephants do the same thing. So there's multiple ways that people gained this knowledge, and then of course they started to pass the knowledge down. And in certain cultures where you had a written tradition, like China or India, these are systems that are 3,000 years old. And then we have more modern traditions, like in the United States, we had doctors, MDs, that were herbal doctors, like the eclectics and the physiomedicalists who existed in much of the 1800s into the early 20th century. And so you have these rich traditions to mine, in a sense, to go in and to learn from, and they help inform us today. And then today we have an additional tool called science. And the problem with science is great, it's a tool. The problem with science is most of the people doing the research on herbs aren't herbalists. And so they're often researching herbs in a way that make no sense to an herbalist, meaning they're researching one herb at a time, which most herbalists would never do, or they're researching isolated compounds, or they're using them in IV. Well, as an herbalist, I don't do IV. Now, granted, there are people who do, with licenses.
And who are very smart.
And probably that's fine, but that's not as an herbalist what I do. And you also have, studies where you have people studying things that just make no sense. It's like when you look at how an herb's traditionally been used and somebody's taking it in some totally different direction based on the fact that there is a chemical in the herb and that one chemical has been found to do this. So now let's see if the herb does that. Most often that kind of stuff fails. But there is occasionally some good research. And I would say that the vast majority of really good herbal research that's taking place in the world today is in China, India, South Korea, Japan, Sweden, Iran, of all places. Those are probably the countries, some out of Germany, that are doing some really good herbal research. And so we have another tool now to sort of validate our 3,000 plus years of human experience.
So now, I'm being really mindful of your time. You got to get out of here and fly away. But, with this trial and error method, can you tell us one story of your trials and errors?
Yeah, I have a good story about that. So one of my first herb books was a book called Back to Eden by Jethro Claus. And it's an interesting book, but it's rather incomplete. But at the time, it was one of the best things I could find. And he talked about this herb called skullcap, Scutellaria lateriflora. And he talked about how it's an incredible herb for irritability and anxiety and agitation and muscle spasm, and even would cure hydrophobia. I didn't know what hydrophobia was, so I looked it up. It's the old name for rabies. So I was like, really? So I looked and I looked and I looked, and I couldn't find skullcap growing anywhere. And so finally I went to my local health food store, which is it was really one of these Seventh-day Adventist stores that sold mostly cans of Worthington fake meat, mostly, I guess, what we now call wheat gluten. Now nobody would want to eat it because it's all gluten. But anyway, and I bought a box of, skullcap, and it was dusty and probably been sitting on the shelf for who knows how long. And it wasn't that I needed something to calm down or anything. I just, again, as I said earlier, I always felt that I had to try things to know what they did. So I made up batches of it, and I, drank it and drank it. I eventually drank the whole box of this stuff, and I didn't notice anything. I mean, zip, it just didn't do anything. And I just thought, I guess he's wrong. It just doesn't work. Some years go by, and I come across a nice patch of skullcap growing in the wild. So I said, maybe it was old. I'll try, So I gathered some skullcap and I dried it carefully, and I made tea out of it again. And, I may have urinated a little bit more, but I was drinking a lot of liquids, but I didn't really notice very much. And again, I was really disappointed, and I said, well, I guess this stuff just doesn't do much. Several more years goes by, and I come across this massive patch of skullcap growing in, and what I later found out is skullcap likes wet. So not standing water, but damp areas. So it was a swampy area and just full of skullcap in bloom. So I gathered a whole bunch of it and I tinctured it fresh. Well, for those people listening, a tincture is an alcohol and water extract. So I tinctured it fresh, and within 2 days I realized something was different, because I had tinctured the dry skullcap and didn't do anything. But it colored the alcohol and water green. But here, there was a greenish blue coating on the inside of the jar that wasn't with the dried skullcap. So I realized there's something volatile here, something that is lost in drying. And it smelled like the nicest liqueur you have ever smelled, which you did not get with the dry stuff. And after it was ready, I started using it. And all of a sudden, all these things that Jethro Claus said that the herb did, I'm seeing it do. Now, it's no good for rabies. But, for people who, when they get tense and nervous, develop, tremors, spasms, nervous tics, fly off the handle anger, skullcap's remarkable. It is a really remarkable plant. Now, I will not say that dry skullcap has no activity, but it has very little activity compared to a fresh tincture or a fresh glycerin extract. That is definitely...
Even the glycerin works.
Yeah, the tincture's better. Yeah, you need to use almost twice as much of the glycerin to get sort of a similar effect. So that, to me, was one of these trial and error experiences. Again, finding the right way. And people say to me all the time, well, what's the best way to take herbs? What herb? Some things a tea. Some things a tincture. Some things a fresh tincture. Some things a dry tincture. Some things a standardized extract. Some things in a capsule. Some things as a solid extract. There are all different ways to take herbs, and it comes down to the herb and the person. So if you have somebody who, for instance, has alcohol abuse issues, don't give them a tincture. You have somebody who, for religious reasons, they're Mormon or Muslim, can't take alcohol, then obviously a tincture is not going to work. You have somebody who won't take anything that tastes bad, well, don't give them a tea of andrographis because it is crazy bitter. And so you have to look at the person. And one of the things I always do with my patients, I ask them in the end of their first interview, I said, what flavors do you love and what flavors do you hate? So they'll say to me, oh, I hate licorice. Well, I guarantee you I'm not putting licorice or star anise or fennel or aniseed in their formulas because I know they don't like it, so they're not going to take it.
The compliance goes out the window.
Exactly. So figure out the person, figure out their likes and dislikes, their health issues that might impact. and then know the herb and what's the best way to get that herb into a person where you're going to get the activity.
Well, David, thank you so much. How can people get a hold of you? What's your website?
I have several websites. You can get a hold of me at herbaltherapeutics.net. That's one website. And then we also have herbalstudies.net, and that's my school. That's the David Winston Center for Herbal Studies. It's a 2-year program in herbal medicine, and it's offered both live online and live in class, so people can be anywhere in the world. We now have students in South Africa, Hong Kong, Israel, Ireland, England, Iceland, Liechtenstein, Costa Rica, all over the U.S. and Canada, and I can promise you it's one of the best programs, for a comprehensive program studying clinical herbal medicine that you will find anywhere. It is now in its 37th and 38th year. There will be at least one more program, the 39th and 40th year, maybe one after that, and then I'm looking to probably retire from the program. And the other website, the herbaltherapeutics.net, has information, articles and books from my library. It has information on my classes and where I'm teaching. And please come and visit.
Oh, I think this is gonna generate a lot of buzz, and hopefully we can get some of this traditional methods and some of these traditional teachings into the community and really give the respect to botanicals that we're lacking right now.
Well, I hope to help as much as I can.
Thank you so much for being here.
Pleasure.